Now let's start with the single best answers from Love and Belly. Part 2, questions from 100 to 200. The first question is: patient presents with torn medial collateral ligament of the knee joint. Which of the following signs may be elicited on physical examination? So here there is an injury from the lateral side. What will have a medial collateral ligament is torn. So there is one is posterior displacement will not be there, anterior displacement of the tibia will not be there. It is because of anterior cruciate, posterior cruciate. Lateral rotation is not is there done in at the level of knee joint. So this is abnormal passive abduction. This is abduction actually at knee joint. There is no abduction, but there will be abnormal passive abduction. That is the answer. Which of the following is DNA sequence technique is so this is DNA sequence southern blotting test. Which one of the following is true concerning the larynx, the posterior cricoarachnoids? So what happens is that all the intrinsic muscles are supplied by recurrent. This is wrong because superior laryngeal is supplying the cricothyroid muscle. Vocal cords are lined by pseudoid, is lined by squamous epithelium. Epitoclot is the elastic cartilage. Cricoid cartilage and tracheal rings are complete. It is now cricoid is complete, tracheal is incomplete. With regard to, now this is question number 4, with regard to chemical neurotransmitter, noradrenaline is predominantly neuron found between the first and second order neuron. Now all have the first order neuron, there is acetylcholine. This is wrong. Then nerve ending of the second order parasympathetic neuron release acetylcholine. So even the second part is also, this is not like that. The nerve ending of second order parasympathetic neurons release acetylcholine that acts on nicotinic cholinergic receptor. It is not, this is about nicotinic, the nervous system. Then here the answer is neuromuscular junction releases acetylcholine that acts on muscarinic. So this is again wrong. Nucleus ambiguous and substantia nigra are rich in dopamine. Nigra is rich in dopamine. This is right. The locus coeruleus so what is there? The nervous system can be divided into somatic, voluntary, and autonomic parts. Autonomic nervous system consists of two, namely sympathetic and parasympathetic. Both sympathetic and parasympathetic fibers consist of two neurons. First order neuron, that is preganglionic, and post order second order neuron, that is postganglionic. And two synapses. The two synapses, synaptic cleft, first and second order neuron cleft between neuron. The key difference between the two neurons, synapses, sympathetic and parasympathetic. First order neuron, sympathetic, parasympathetic, are myelinated, whereas second order neuron, postganglionic, sympathetic, parasympathetic, are small and unmyelinated. In both sympathetic and parasympathetic fibers, preganglionic release acetylcholine. So here is acetylcholine in the presympathetic. However, they differ in the second synapse between second order neuron infected by non-ordinary principle came used within the sympathetic. And although it is not entirely true, because post-ganglionic sympathetic fibers to sweat gland, pilorectal muscle, and few blood vessels are cholinergic. So, but acetylcholine is the principal neurotransmitter within the parasympathetic nervous system, but this time acting on muscarinic. So the second part, nerve ending of second parasympathetic neurons release acetylcholine acts on nicotinic. So it is muscarinic. Then neuromuscular junction release acetylcholine that acts on muscarinic cholinergic receptor. It is not only muscarinic; it can be muscarinic as well as via nicotinic, as the substantia nigra is the dense dopaminergic. The locus coeruleus and periaqueductal gray are rich in acetylcholine. Excess catecholamines are secreted in tumor adrenaline, although ground of pathogenic bacteria enter the body by various routes and entry mechanism critical for understanding pathogenesis and transmission of each, and which pathogen is correctly linked to the mode of entry. So we have to just link the mode of entry. The Neisser meningitis is which is correct, they are asking. Okay, so it's not correct. Neisser meningitis is not through the signal. Cognitive bacterium diphtheria, it's again not foodborne. It is Clostridium tetani is not inhalation, it is injury from the Bordetella burgdorferi, arthropod vector-borne entry. This is spread by ticks and caused by rickettsia. Clostridium tetani enters through the wounds. Meningitis and contaminant are both into respiratory tract. This is respiratory RS. This is RS. This one is by entry through wound. And Bordetella vector-borne arthropod is true. Rickettsia contaminated wound. The rickettsia actually it is through by ticks. It is not through the wounds. It is through ticks. With regard to gene expression, translation occurs in nucleus of eukaryotes. What is gene expression? DNA polymerase manufacture. So it is DNA polymerase 2 gives rise to protein encoding mRNA. So how is this? In prokaryocytes, transcription translation occurs in cytoplasm. Translation occurs in nucleus. It is not in nucleus, it is in cytoplasm. So introns code for proteins. Transcription occurs in nucleus and translation in cytoplasm, transcription in nucleus. So transcription nucleus, what happens? It is transcription. Introns code for proteins. Synthesizing transcription mRNA, it is categorized by enzyme, it is RNA. The production of mature mRNA result from gene splicing. Introns, which are non-coding sequence of DNA, are removed and intervening exons are joined together. So introns, which are non-coding sequence of DNA, it is not for the proteins. DNA polymerase manufacture DNA 3-5 direction. Amino acids are coded by group of 3 bases and 3 potential codes. 20 amino acids are used in protein synthesis. So in fact 44 codons are. So in this the answer is D. RNA polymerase 2 gives rise to protein encoding. It is protein encoding is by mRNA. So codons are formed from the group of 3 amino acids. Actually it is amino acids are coded by 3 bases and 3 bases make the codons. So it is not 3 amino acids, as there are 4 bases, 4 types of bases, there are potential and only 20 amino acids are used of protein synthesis. It is not 3 amino acids, it is 3 bases. Concerning the thyroid gland, which one of the following is correct? Blood supplies through internal carotid and subclavian arteries. Internal carotid is not, it is external carotid artery. Embryologically starts at the base of foramen cecum of the tongue. This is correct. Venous drainage by the way of external jugular vein. No, it is into internal jugular vein. Produce thyroid stimulating hormone. Thyroid produces T3 and T4. Attached to thyroid cartilage by Bary's ligament. It's not by Bary's ligament. It is attached to thyroid cartilage by pretracheal fascia. So thyroid gland is endocrine gland, sits on the base of neck and it is consists of 2 lateral lobes. It is attached by Bary's ligament to 2nd to 4th tracheal rings. Attached to thyroid cartilage. It is not attached to thyroid cartilage, to the tracheal rings, which is attached by Bary's ligament to 2nd and 4th tracheal ring. It is not attached to thyroid cartilage but sits lower down in the neck. So this is not attached to thyroid cartilage, it is attached to tracheal rings. So next question is common opiates. Opiates commonly causes diarrhea, act on central, mediate. So this is opiates commonly causes diarrhea. Opiates are mainly used in hospital setting for analgesia properties. These are now believed to both peripherally outside the central nervous system as well as CNS itself. Unfortunately, opiates exerts most of the beneficial effects and side effects to the same opioid receptor, that is mu receptors. These are mediated by mu receptors. It is therefore unlikely that we will ever be able to develop synthetic opioid agent that has analgesic properties of other opioids without their unpleasant side effects. Opioid induce side effects that both excitatory and inhibitory mechanisms. Excitatory effects are, what are the excitatory effects? This cause pinpoint pupil direct effect of opioids on Edinger vesper nucleus, commonly cause the nausea, vomiting. So this is not the diarrhea, is not the nausea, vomiting is there. Acts on centrally, it is peripheral as well central, mediate most of through mu receptors, lead to tolerance. So pruritus, dysphoria, euphoria can be reversed by flumanazole. Inhibitory effects are cardiorespiratory, sedation, relaxation of smooth muscles, constipation, urinary retention. It is not diarrhea, it causes constipation. So can be reversed by constipation, nausea, vomiting, it is therefore always good idea to prescribe laxative and emetics whenever opiates are necessary. Opioid causes tolerance. This is the answer. It causes tolerance, dependence, and withdrawal with increasing use. Tolerance means increasing dose of opioid drugs are needed to in order to order same effect. It is important to know to reverse the effect of opioid because opioid overdose may be fatal. Specific opioid antagonists are, it is not flumanazole, it is naloxone. Naloxone is the antagonist. Flumanazine antagonizes the effects of benzodiazepines. This is used for benzodiazepines. Type 1 hypersensitivity is caused by antigen reacting IgM. No antigen. This is results in mass degradation. No, it is basically mass degradation. Yes, it is IgE. It is allergic type of hypersensitivity. Is the continuation is characterized by Arthur's reaction. 42 hours develop. It causes formation of antibody. Is in which undesirable tissue damage follows development of the humoral cell mediated genes. Type 1 is mast cell mediated IgE bound. Type 2 is antibodies. This is anaphylaxis. This is cytotoxic to the antibodies caused by cytotoxic. 3 is because of immunocomplexes. ACLE. 4 is delayed type of, and 5 is again due to formation of autoantibodies, autoimmune Graves' disease. Which one of the following statement concerning referred pain is true? Pain from the transverse colon is usually referred to midline below the umbilicus. So, referred pain from transverse colon is usually referred to midline below umbilicus. So this is true. Referred pain is not well understood. Somatic sensory other somatic pain is usually referred in diffuse. It is actually poorly localized. It is localized. The mechanism of referred pain is well understood. It is poorly understood. Diaphragmatic pain is usually referred to inguinal area. It is shoulder. Pain from the inflammation referred to medial thigh. Inflammatory appendix to umbilicus. Very well localized and